Good evening, everyone. Welcome to the Medical College of Georgia, Augusta University 2020 Resident and Fellow Graduation. First of all, I would like to apologize to the graduates and their families for not being able to have the celebration festivities they deserve, but COVID-19 has changed our lives, at least for the time being. I would like to invite our graduates and their families back to any of our future graduation events and take part in our festive activities. Before we start, I would like to recognize Caroline Cook, Donna Black, and Corinne Colisar for making this virtual program possible. Thank you. This virtual event is planned to last no more than 30 minutes. So I will move on to the next item of the agenda, and that is announcement of awards, and I will begin with Consultant of the Year Award. The faculty members and chief residents unanimously selected Dr. Scott Rahimi, Associate Professor of Neurosurgery, as the recipient of our Consultant of the Year Award. Dr. Rahimi received his medical degree from the Medical College of Georgia, completed his neurosurgery residency here at AUMC, Augusta University Medical Center, and then completed a fellowship at Emory University. He joined the faculty at MCG in 2010. And now I would like to invite Dr. Greg Postma to announce the Airway Award recipient. Greg?
Thank you, Still. Every year, the residents and faculty get together and determine who had the best airway save of any given year. We've actually not given it one or two different years. And this year, there was the most junior person to ever have won the award. While on call, our PG2 resident, Dr. Jeff Falco, was called to see a 19-month-old in respiratory distress. He did a quick laryngoscopy on the struggling stridulous child and then elected to be particularly aggressive and, to say the least, reached in with McGill forceps in this child and pulled out a giant piece of flowering grass, immediately alleviating the child's respiratory distress. In fact, everything went so well, the on-call attending wanted the next day or later that day to have the child undergo an airway examination. The parents were so happy and so excited for Dr. Falco's great work that they left AMA from our emergency department. So Dr. Falco will be getting the award is always a $200 cricothyroidotomy kit, which they can put in their pocket and even hang around their neck with a gold chain. Congratulations, Jeff.
And now I would like to invite Dr. Michael Groves to announce the Temporal Bone Award recipient.
So the Temporal Bone Award is awarded every year by the otology faculty. Dr. Sayedi, he asked me to step in this year, and it's different criteria depending on the individual year. This year it was a drilling competition scored by Dr. Sayedi, and the award winner is Dr. Luke Edelmeyer. No surprise, starting his otology fellowship about 1 year from now. So congratulations, Luke Edelmeyer.
Next, we recognize our fellows and present them with their certificates. And I will start with the rhinologist skull-base surgery fellow, Dr. Chadi Makari. Dr. Makari was an assistant professor of otolaryngology at West Virginia University when he came to Augusta for his fellowship. And he's now going back as associate professor and vice chair of clinical services, as well as the medical director of the clinic. Personally, I enjoyed the year immensely, and I strongly believe that Dr. Makari will have a great academic career and make us all proud. I wish him and his family the best of luck. He's receiving his diploma, and as a small token of appreciation, the traditional MCG clock. Charlie, thank you.
Six feet.
Thank you, mascot. For the picture.
No.
Looks great.
Okay, thank you. And the MCG plaque.
60. Wonderful.
All right, great. Thank you. Thank you. Next is Dr. Postman.
Our fellow this year, Dr. Michael Yang, got infected with the laryngology bug while at the SHRE, LSU Shreveport, from one of our own, Dr. Paul Weinberger. And we've had a fantastic year. We've had a lot of fun socially. He's done a fantastic job in the OR, as well as academically. And we've had a fantastic time getting to know Mike, as well as his wonderful girlfriend, Morgan. And we're going to miss him. And he has taken over one of the largest laryngology centers in the nation in San Antonio. They had not one, but 2 full-time laryngologists leave, and he's going there to be their savior. And so Mike was fantastic here. And likewise, you get your diploma, 2 diplomas actually.
Great.
And a clock as well.
Awesome.
Congratulations, Mike.
Thank you.
Next is Dr. Berg for Dr. Ahmad El-Taledi.
So Ahmad joined us after spending a year with Dr. David Harris doing endocrine surgery last year, and had a desire to learn more about head and neck surgery so he can be the man when he returns back to Egypt. Ahmad's attitude was so positive, and everybody enjoyed working with him so much that we asked him to stay on for this year. And he's had a great desire to learn. His attitude has been one of the best out of anyone I've worked with. He I think is a very caring person, really cares about the patients, really cares about the surgery, and we look forward to great things from him next year when he returns to Cairo and really gets ramped up. So we have, for Ahmad, we have the, actually have a plaque. I didn't know everybody was doing clocks, but
Yeah.
okay,
Go clock.
that's what I figured. As well as a diploma for head and neck.
Awesome.
Additionally, Ahmad is known in the OR as being a kind of a cookie monster. So we got 2 month cookies.
Wow.
Sorry, one second. It doesn't recognize my face with the mask on. Okay.
And next is Dr. Terrace for a virtual presentation for Dr. David Timmerman and Dr. Ranim Al-Sharif. Dr. Terrace?
Okay, can everybody hear me?
Yes.
Okay. So it's been another busy and productive year for the endocrine service. Despite the slowdowns, lockdowns, we still managed to accomplish over 500 thyroid and parathyroid surgeries. And of course, we're here to honor our fellowship graduates, but I wanted to give a quick shout out to Greer Albergati, who's been a tremendous partner and responsible for an increasing proportion of these 500 cases. So thank you, Greer. And thank you to our graduating fellows. Obviously, we're all living through historic times with this coronavirus, but we made our own history on the endocrine service. This is the first time we've ever had 2 fellows instead of 1. And I'm going to start with Ranim Al-Sharif. Raneem came to us from King Saud University in Riyadh, Saudi Arabia. And as many of you know, this is the premier training ground for otolaryngology residents in Saudi Arabia. What you may not know is that the training and scope of practice are very different from the United States. The surgery exposure is mostly observational, and much of the surgical caseload is like the United States was in the 70s and 80s, a lot of septoplasties, tubes, and tonsils, and very limited soft tissue surgery. So given that context, I'm overall very pleased with how Raneem has performed and how she has progressed. She does very nice patient evaluations in the office and has steadily improved her surgical skills. Raneem will return home to Saudi Arabia for a year, where she will rejoin her department at King Saud University, and anticipates returning to the US to pursue additional fellowship training in ablative and reconstructive head and neck surgery. Raneem, thank you so much for your contributions and being part of our department this year. Please accept a virtual hug, and we'll see you Wednesday for the real one. And we'll do our certificates next week on the endocrine service. Secondly, I just want to spend a minute talking about Dave Temmermans. And of course, it's cliche to talk about the residents and fellows being like our children, but I think it's actually true. And we all know we're not supposed to have favorites when it comes to our kids, but I have to admit, Dave is one of my favorites. He's got the whole package. He's smart and inquisitive. He communicates well. He has excellent surgical skills. More than most fellows I've trained, Dave also clearly embraced the opportunity to thoroughly learn all aspects of endocrine surgery and invested himself into his own training. That's why he graduates as an outstanding endocrine surgeon in his own right. As an aside, sometimes trainees I find are somewhat detached emotionally from the outcomes we achieve together. Dave consistently shared emotionally and psychologically, both in the triumphs and the defeats throughout the year. And certainly as attendings, we appreciate that. Lastly, I guess we're close enough to the end of the fellowship, I can make an additional confession. We didn't really recruit you to Augusta, Dave. We actually wanted to get Rhea here for a year, and you were just part of the package. But seriously though, you and Rhea are gonna be a spectacular medical couple with an exciting and rewarding future. It was a bonus getting to know Ali and Bo, and I wish we could have spent more time together except for this Corona problem. Most people know Dave is from New Jersey, and he and Rhea will return there. Well, Dave will join a private practice made up of several of his residency mentors, and Rhea will matriculate in a doctoral program in pharmacology and physiology at Drexel University. So we wish you and Raneem the very best of luck and success with your careers. And as I said, we'll be having a separate and smaller endocrine ceremony next week, and we'll see you then.
Thank you, Dr. Terrace. Now, before we move on to recognize our chief residents, I'd like to take a moment and recognize Dr. Michael Groves for being our program director from 2014 till June of 2020. Dr. Groves has done an excellent job to run the program without citations throughout his tenure. And he's advancing now to be an associate dean of graduate medical education and also the associate designated institutional official. As a token of our appreciation, the department offers Dr. Groves the MCG clock and the plaque that states, in recognition of your contributions and leadership as otolaryngology residency program director, September 2014, June 2020, Medical College of Georgia, Augusta University Department of Otolaryngology, Head and Neck Surgery.
Thank you.
It's great.
Next is recognition of our chief residents, Dr. Groves.
So I realize there's a significant challenge in trying to do anything humorous via Zoom without much audience reaction and a striking lack of alcohol. So this may not be quite as funny as past years, but we're going to try to have a little bit of fun. So Calvin and Zach came in and immediately were like brothers. And most battle situations, you might say brothers in arms. But from the very beginning with Calvin and Zach, it was brothers at arms, always competing like the siblings that they must be. So next slide. So Zach grew up in Florida. Calvin grew up in Burma. Calvin, which one are you, right or left in that picture?
Can't tell.
You don't know either. I was trying to figure it out. I was looking at your fingers and I figured it must have been pre-monkey. So but you know, Florida is pretty much the Burma of the United States. So it's hot, humid, and there's beaches, snakes. So it seems like they grew up in very similar environments. Next slide. So one of the things we like to do in this presentation is just look back at their applications and look at a little bit about what they said and what we said. And so when I looked at Calvin's personal statement, I was like, wow, there was nothing funny in there. And then I looked at his picture and I said, it pretty much goes with the picture on his application as well. I'm not really sure if he has a funny bone in his body at this point, just reading the personal statement. But when we got to know Calvin, we knew that he actually did have a good sense of humor. But what we said, a lot of people pointed out that he was a professional photographer, and then again, looking at the picture, I could really tell his flair for the artistic. The next, great sense of humor. So someone, despite the personal statement and despite the picture, was able to get some sort of humorous statement out of Calvin on his interview day. And next, someone had to get the details of the monkey finger on his interview day. And the quote, they kind of explained the situation, and the quote was, "I can do a lot of blunt dissection." So I guess Calvin was demonstrating why this would not be a disability and might actually be an asset to him in the operating room. So, all right, next. And there's Calvin overcoming his fear and confronting some more monkeys even after the incident. So, Zach, all right. So what did Zach say? First, so he was talking about the variety in ENT and how it mirrors his well-rounded liberal arts education. So he's kind of justifying his studying classics in college. I don't know why anyone would study classics for any reason. But then I started thinking, what do you mean by well-rounded liberal arts education? And then I saw some pictures from college, and I said, he must be thinking about his face. Yeah, there's his well-rounded education. Next one, my work ethic and again, he tries to justify the liberal arts education with the classics would be strengths that it would ensure his success in otolaryngology. I still don't understand the link, but maybe it's just me. All right, next. And that he insisted that he was receptive and appreciative, not of feedback, but of criticism nonetheless. Yeah. So I found that hard to believe knowing Zach now for 5 years. Certainly interested in getting feedback, criticism, maybe not so much. So what did we say about Zach? Detected a bit of arrogance. And I think the picture has a lot to do with it. There's just this sort of chin up, posture. But then I realized that's just how Zach smiles. Every picture that he took as a kid even had the chin up. That's just the way he is. So it's not arrogance at all. He has a strong respect for authority. That was quoted by multiple people, and motivated, self-motivated, eager. So everyone picked up that Zach was in it to win it. So next slide. So Zach and Calvin. Calvin is going to be joining ear, nose, and throat specialists in Conyers, Georgia, as not a general otolaryngologist, but a comprehensive otolaryngologist. And Zach will pursue fellowship in facial plastic and reconstructive surgery at Northwestern, a prestigious university in the Midwest. And next slide. So although Calvin is very upset about having to leave, and watching them go means we might have to see that one more time on the way out. We are sad to see Calvin and Zach go, and we hope that, next slide, they'll come and join us together soon. This time as brothers in arms, like they started off.
I took that picture.
Thank you, Zach and Colin, for all your hard work. Now we're going to give the graduates their certificates. Dr. Kuntakis.
Zach. Stand between me and Dr. Rose. Rose, put your hand on there. Social distancing.
Keep the chin up, Zach.
Chin up, chin up.
Chin up.
Awesome.
And Calvin?
Oh. Looks great.
Congratulations.
Let's see. Bring the chair up a little bit. So next, we'll allow our chief residents to share with us a few comments.
I really want to thank everybody. I want to thank my wife first because she's been there for me and supported me and raised two beautiful children. And sorry I wasn't able to be there for you all the time. I want to thank all the attending for their teaching, their guidance, and their protection against me. I do want to let you all know that before I send you the note, I did read it one time for grammar error. So even though there might still be grammar error, please forgive me because we don't have past tense, future tense, or like plural and singular in our language. So I would like to thank my co-resident Zach, like Dr. Gross said, he's just being so competitive that it just made me want to be better than him all the time. And also all the resident, all the MP and PA, all the office staff, Caroline, all our clinic staff, everybody. Thank you very much for the last 5 years.
Oh.
We're hugging it. Oh, this seems a long time coming, and I'd just like to thank a lot of people, especially my wife, who is the most important person in my life. She's helped me get through this. She's a really powerful nurse, way better at her job than I am at mine, and she's helped me get through the last 5 years. And I can't wait to start our life in Chicago together. I'd also like to thank my family, my parents, my in-laws, all of my co-residents, especially Calvin, who literally has always been there for me. We've always bounced things off each other, and he's made residency very tolerable. I'd like to thank my dogs, Belle and Cody, and then I'd like to thank my attendings. I didn't mean to do it in that order.
There's the priority.
Hey, my dogs are my emotional support animals, so that means a lot. But anyways, I'd like to thank all my attendings, especially for the criticism I received, because it's really helped me mold me into the individual I am today. And I'd also like to thank all our staff, all the clinic staff, Caroline, all of our otolaryngology staff has been incredible over the years. And the fellows this year have been superb. Like, they have helped mold our education and really make it an awesome year for our learning. Yeah, thank you very much. It's been a great 5 years. And Calvin and I would definitely do it again with all these people. So thank you very much.
And now please join us for a toast to our graduates. Dr. Groves.
You might give each other a sip.
This is apple cider.
But yes, this is apple cider, university property. So I don't have a formal toast, but I would like to say that it's been a great 5 years. Every time we match a new cohort of residents, as soon as I send out the email, letting everyone know which residents we got from the match, I get at least 3 or 4 immediate responses that say, "Are we happy?"
Mhm.
And in y'all's case, I was able to immediately respond, "We are definitely happy." And you guys proved it. You guys worked really hard. You learned a ton. You took a lot of took great care of the patients. We know you're prepared to go on and do great things and continue that trajectory. We're proud to call you guys MCG graduates. So we encourage you to come back and visit us whenever you can. And so to Zach and to Calvin, cheers.
Cheers.
Cheers. Good luck.
Cheers.
Calvin, good luck.
Thank you.
Zach, wish you the best.
All right. Thank you, everybody. Yeah.
Yes. Hey, dude.
Thank you. This is the end of our program. We're still on? This is the end of our program. Thank you for joining us, and hopefully in the future we'll be able to do it in person and have a great celebration. And you're all invited to come back anytime. Bring your families back. Thank you. Bye-bye.
Bye.